Hello everyone, this is a review of the Healthy Community Brookfield, or the HCB, for today's date of April 19th, 2023. My name is Emily Susi, and I'm the Healthy Community Brookfield Executive Director, reaching out to you guys, our Board of Directors, on how we wish to improve our very important organization. So the goals of this presentation are to give a general overview of our program, including our history and the services we provide to the community. We want to give a background of any environmental influences that affect our organization, including community expectations and relationships, and the economic conditions. We also want to provide a situational analysis of our organization's strengths, weaknesses, opportunities, and threats, or SWOT. And we will go over the current mission statement and vision statement, as well as a new proposed mission statement and vision statement. Then we will go over a 5-year strategic plan, as well as our action plan and how we will meet our goals to meet this specific plan. Finally, we will talk about how we will evaluate the efficacy of our plans in the next 3 to 5 years. So for a little bit of our history, in 1997, a benefactor donated $2 million to create our program, and the focus was to expand the health promotion and wellness throughout our county. In 1998, our organization officially started, and it was formed as a Department of Local and County-Sponsored Nursing Visiting Agency, or a VNA, and our proposed management was for 2 state contracts, and they were intervention and prevention of cardiovascular disease in our populations and health promotion initiatives throughout the schools in our county. In 2008, we hired our chief financial officer, an expert program planner, and a grant writer, and they joined our team. This allowed for better programmatic and financial stability. We also developed contracts with the county health officials, which allowed us to create several state-mandated public health programs. We also have a wide variety of programs for our community. These include the women's health and primary care medical services, mobile health medicine services, prenatal and newborn care, which is a county public health contract. We also have care management, especially for those that are just discharged out of the hospital, a smoking cessation class, and which is a part of the county public health contract, a violence prevention program, teen after-school programs, a newly diagnosed diabetes education, wellness and fitness groups, wellness water testing and mitigation assistance, vaccines and immunization services, which is also a county public health contract program. So for our environmental factors, we have the community expectations. So what they really want from us is to know what needs are in for our county and what are vital for continuation, and base it off of what is already present and see where we can merge the programs or create more in-depth programs. And then we have interacting within the community, providing more information as to what our company does would be very beneficial, as most people in the community do not know exactly what our organization does. For community relationships, we do have a rocky relationship with those in the community. They are unsure of what our company does, but they know we are trying to do good in this community. And many believe that our program is still a part of the VNA program, a extension of a department or the county hospital or the county health department, which causes many confusion. And then for our key stakeholders, many of them question our programs. Primary care physicians question why we provide those services when they already have a number of private providers already in the community. local law enforcement questions our strategies when it comes to the violence prevention program. And the hospital is unclear about our elderly follow-up care, post-hospitalization, and diabetes education programs, as they have their own. And local farmers are very frustrated by the extensive well water testing and our constant encouragements to invest in expensive mitigation systems. There are also a lot of duplicate services, such as the school programs and violence programs that are already offered in the community. And then county officials are very frustrated with us by our yearly demands for increased funding. So our major economic force that influences us is that we are in a community that is deemed low socioeconomic. And so there is minimal state-sponsored public health infrastructure, and the county health department is struggling themselves with the limited resources. Finally, for our internal forces, there is no solid agreement on what our company represents and how it is run. Our board of directors, you all, want us to apply for every grant that we can possibly apply for and hope one will stick. It doesn't matter if it's with our mission and vision statements, you just want to find something that works. And our employment is very unstable, and it will depend on what funding we have for that fiscal year, which creates a lot of external issues. So for our SWOT analysis, we have our strengths. So our strengths are, we are nonprofit, therefore we can offer our programs to anyone that qualifies despite insurance status. Therefore, when an individual qualifies, the services will be covered, including our women's health and primary care services. So those who need our services will not have to pay out of pocket like with private organizations, which we have a lot of around our community. We offer a variety of services and programs that the community can utilize, including education and mobile health care. And this allows for the base of our community needs and to meet the needs of the community. We do have a few weaknesses. Biggest one is financial instability. Our funding disbursement is a little out there and inconsistent. We also have no solid long-term financial plan that will help us to keep our programs running. We have unstable employment, as I had mentioned earlier, with the internal disagreements as well. We have a lot of duplicate programs, and we have a lot of external frustrations when it comes to the community and our key stakeholders. So for our opportunities, we do have a lot of opportunities and room for improvement. Any new hires that we have been hiring, such as our new CFO and the expert program planner, will allow for new programs to actually be developed for our community. And any new hires or returning employees can help and go out actually into the community and see what they want to see for programs from us. We also have the opportunity to create a new mission statement and a new vision statement, and with that we can get community input and go from there. So for our threats, we have a couple major ones. The first is our accreditation failing of our Domain 9 accreditation, and this takes away all government funding that we would have from the public health department. We also have a lot of funding cycles ending, including our newly diagnosed diabetes program and the well water testing and mitigation program are both in jeopardy. And funding for the key programs is also at a threat level because we are almost out of our funding that originally came in 1997. So that is very crucial that we improve on finding better funding and get our accreditation completed so we have government funding. Finally, we are in a community that has low socioeconomic factors, as mentioned earlier, So there is minimal public health infrastructure, and we don't have the resources that major cities would have as compared to smaller counties. So for the current mission and vision statements, the current mission statement is, as a nonprofit organization, Healthy Community Brookfield strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. And the vision statement is, as a nonprofit organization, Healthy Community Brookfield promotes healthy practices which can lead to improved health behaviors, healthier individuals, and healthier communities. So for our new proposed mission and vision statement, our new mission statement can be to aim to provide the community with preventative programs and improve the health of the community through education and low-cost treatments. And the new vision statement can be, Healthy Community Brookfield is to provide the health amenities and resources to the community while also providing educational access to everyone in the community. So with our 5-year strategic plan, we would really have to get in the field, get our hands dirty, and learn what is desired from our community. And from there, we can restructure programs, restructure all of our employment so that everyone feels like they have a position at our organization. And from there, we can create goals for the programs and make a solid long-term financial plan. So in order to do all of that, we will need to create an internal review as well as an external review to see what each community needs, whether it's those that are in the county or from our employments. And finally, create objectives that will be important in our mission. And in order to evaluate these, we will have constant interviews with the community and our key stakeholders, as well as meetings that will be focused on internal matters in order to make sure that everything is being handled properly. So in conclusion, if we work to make these changes and adjust for the accreditation lack of, we will have a very successful organization that is nonprofit and works for our community. So I think as long as we keep working hard and keep providing our services, everything will work out well. And those are my sources.